Welcome to Mind Body Magic with Dr. B. I'm glad you're here. I'm Tiffany Ballard, also known as Dr. B. I've been practicing psychotherapy, psychiatry, and osteopathic medicine for 20 plus years. Alongside my medical practice, I create as a self-taught photographer, graphic designer, and I'm attempting to learn videography. I'm also a pretty big productivity and tech gadget nerd. You might be wondering why I'm starting my first YouTube channel in my 50s. Well, the answer lies in my passion for reaching more people and helping them, other than the privileged few that get to see me in my outpatient practice. And I really want to help you, the person watching, upgrade your toolkit for facing these challenging times. Our healthcare system here in the United States is quite a bit burdened, and it's an impact on not just me, but my colleagues, most of my patients, family, and friends, and maybe you experience this as well. Have you or a loved one experienced any shortages in medications that you need to treat your ADHD? This is a topic I plan to cover, along with other advocacy and empowering actions you can take to improve your situation, your child's situation. And I'd like you to stick around for one more tip that can help specifically you and your prescriber about the stimulant shortages. So stay tuned for that later in the video. I want to tell you a little more about myself and why I'm starting this channel. Growing up, I witnessed my mother's severe bipolar illness and the inadequate mental health care she received in our small Texas town. Seeing her struggle and being experimented on with different treatments without proper support was heartbreaking. And a lot of the burden fell to us, her loved ones and family members. Later, even when she was in hospice, it was challenging to get her psychiatric care she needed to relieve her psychosis in the end. These experiences profoundly shaped my passion for mental health, always have, and my desire for improved care. I experienced ADHD symptoms myself, but I only recognized them much later in adulthood. And I'll share my wisdom and creativity born from having a brain that functioned very differently than those around me. For a long time, it was challenging, feeling like I wasn't smart or that something was wrong with me because I couldn't get things to work the way they seemed to work for the people around me. I've shared these personal stories in honor of Mental Health Awareness Week, also because they've really shaped who I am and how I help people. And if you're interested in following my content, it's important to know this about me. Understanding mental health stigma and empowering advocacy is something I want to help you with today on this video. Have you ever been taken less seriously because of your mental illness? Have you noticed that happen to a loved one? Mental health stigma can prevent people from seeking the help they need. It's important to talk openly about mental health and support others in doing the same. Remember, seeking help is a sign of strength, not weakness. Now, moving on to my next tip for advocacy, something that can help you out. I often recommend this to my patients when we talk about their frustration with going to their doctor's office for a visit, their 3-month visit, checking up on something, and then when they leave the office and get in the car, they remember questions they wanted to ask that they didn't have time to or didn't think of during the actual follow-up appointment while they were in front of the provider. So the tip is, always write these down. When you think of questions when you leave your doctor's office, it's important to write them down and get in your portal, send a chat to your doctor, your electronic health records, your portal, or pick up the phone, old school like, and talk to the secretary or nurse and just say, hey, I had a few questions I didn't get addressed. Can you please help? It gets put in the chart. The doctor has to pay attention to it unless, well, I mean, they're supposed to, and they will get back with you. It's important part of your care. Even if they call back and go, oh my gosh, this is a lot of questions, let's schedule another appointment. You're doing your part to make sure that things don't get dropped off. That's important. That's something you can actually do that will make a difference. Don't go, oh, I don't know, it's not that important. Or don't Google it instead of asking them. You can Google, don't get me wrong. Just ask them too. Keep them in the loop. Now, the other tip you may have been waiting for about that tip, if you're running into stimulant shortages, something you can pass on to the prescriber of your medications for the stimulants. Stimulant medications are medications like Ritalin, Concerta, Vyvanse, Adderall. Okay, so I got this from a wise and very helpful HEB pharmacist. And he was very helpful. And he said, what you do is have the prescriber write. There's a notes section in the electronic prescribing or in handwritten, but I think most of us are required to do electronic unless something's really broken down and we have to do paper nowadays. And you have the prescriber write, brand name okay if generic is unavailable. This will save you and your office time and frustration, as well as you, the patient, that might be wanting to go pick it up. Because that removes a whole step the pharmacy would have to take that involves reaching out to the doctor when the generic isn't available. Now, the patient may show up and go, no, I'm not paying $400 for this. I don't have the money for that. That's always the option, because if they fill brand, you're going to pay for brand, most likely. Let's get you set up with a quick stress management, mind-body connecting technique before you go. And this technique is something that you can do wherever you are without drawing attention to yourself. You don't have to stop in the middle of anything necessarily. This is called the 5-4-3-2-1 grounding exercise and breathing technique. It's simple and effective to help ground you, and you could do it anywhere, anytime you feel stressed or overwhelmed. 5-4-3-2-1 grounding technique. This technique helps bring your focus back to the present moment using your 5 senses. Let's start. First, look around. We're using our vision and find 5 things you can see. Could be anything, like a book on a shelf, a bird outside the window, a piece of art on the wall. Next, touch 4 things around you. Feel the texture of your clothes, maybe the smoothness of your phone, or the warmth of a coffee cup. Next, listen for 3 sounds. It might be the hum of a refrigerator, chirping of birds, or distant traffic. After that, notice 2 things you can smell. Maybe it's a scent of lotion or a smell of fresh air. Finally, focus on 1 taste. It can be remnants of the last meal you had or the taste of your own saliva. Now, to further get embodied and calm your mind, let's do a quick breathing technique. This can be done standalone as well. I use it often. It's the 4-4-4 technique. Sit or stand comfortably and breathe in slowly through your nose to the count of 4. Then hold your breath for a count of 4. Then exhale slowly through your mouth for the count of 4. Repeat this cycle 3 more times. Now that we've learned some useful mental health awareness, patient advocacy tips to help you feel more empowered, and we've done an experiential mind-body stress-reducing technique, you're getting an idea about what my videos will be about. Creating a YouTube channel is a creative process, and I want to play and create with you. So let's do this together. Post comments about the videos you'd like to see, engage, and help me make this channel into something even better than I could have imagined. Because I'm going to be consistent. I'm putting this out there, and I'm really ready. My last tip is to be super patient and kind with yourself wherever you are on your mental, emotional resilience or health journey. On this channel, we'll cover everything from mindfulness techniques like you saw to functional medicine wisdom and insights and productivity hacks and ADHD strategies, as well as tech tips. And of course, at some point soon, you'll get to meet my adorable Australian Shepherd puppy, Pie, who makes things very lively around here. If you found any of this helpful, please like and consider watching the next video I've got ready for you. And join me on this journey to transform cutting-edge health knowledge into everyday magic. And there's another one ready for you right here to dive deeper. So thank you for visiting. Stay tuned, stay inspired, and take care of your heart and mind.